West Nile virus alert, Maricopa County reports first death of season, protect yourself. A tragic reminder, West Nile virus claims its first victim in Maricopa County this season. The Maricopa County Department of Public Health has just confirmed the first West Nile virus-related death of the season, a sobering reminder that this mosquito-borne illness can be deadly, especially for older adults and those with underlying health conditions. The victim, an older adult with pre-existing health issues, succumbed to the virus, highlighting the importance of vigilance during monsoon season when mosquitoes are most active. The perfect storm, monsoon season and mosquito activity. Dr. Nick Staub, Chief Medical Officer for MCDPH, emphasized the need for residents to take precautions, saying, "Monsoon season brings much-needed rain, but it also creates ideal breeding conditions for mosquitoes. That's why it's crucial for residents to stay vigilant, use insect repellent, drain standing water, and limit outdoor time during peak mosquito activity." With 17 human cases of West Nile virus already confirmed in Maricopa County this year, the risk is real, and the consequences can be devastating. Understanding West Nile virus, a silent killer. So, what is West Nile virus, and how is it spread? The virus is typically transmitted through the bite of an infected mosquito, and most people infected don't show symptoms. However, about 1 in 5 people may develop a flu-like illness with fever, headache, and body aches. In rare cases, about 1 in 150, the virus can cause severe complications like encephalitis or meningitis, which may lead to paralysis, long-term disability, or death. Older adults, people with underlying health conditions, and those with weakened immune systems are at higher risk for severe illness. Fighting the bite, a collective effort. To combat the spread of West Nile virus, MCDPH works closely with healthcare providers, Maricopa County Environmental Services Department, MCEST, and state and federal partners to maintain strong surveillance for both humans and mosquitoes and to implement prevention strategies. MCEST conducts a proactive and aggressive year-round mosquito surveillance and abatement program. Public health officials urge all residents and visitors to fight the bite and follow simple precautions to avoid mosquitoes and the diseases they may carry. Simple precautions, big impact. So, what can you do to protect yourself and your loved ones? Here are some simple yet effective precautions. West Nile virus alert, first death reported in Maricopa County. A stark reminder, West Nile virus claims its first victim this season. In a sobering announcement, Maricopa County has reported its first fatality of the season linked to the West Nile virus, a disease that is primarily transmitted to humans through mosquito bites. This news serves as a crucial wake-up call for residents, highlighting the serious nature of this virus, particularly for vulnerable populations. According to the Maricopa County Department of Public Health, there have already been 17 confirmed cases of West Nile virus among humans this year. The unfortunate victim was an older adult who had pre-existing health issues, as noted by Dr. Nick Staub, the Chief Medical Officer for the department. Dr. Staub emphasized the gravity of this situation, stating, "This tragic loss is a reminder that West Nile virus can be serious, especially for older adults and those with existing health conditions." This statement underscores the importance of awareness and preventive measures as the season progresses. Understanding the risks, what you need to know. Interestingly, most individuals infected with the West Nile virus do not exhibit any symptoms. In fact, only about 20% of those infected will experience signs such as fever, headaches, body aches, and muscle weakness. While it is uncommon for the condition to escalate, it can lead to severe complications like encephalitis or meningitis in approximately 1 out of every 150 cases. When such severe symptoms occur, victims may face debilitating issues including headaches, neck stiffness, vision impairment, and even paralysis. This stark reality raises the question, are we doing enough to protect ourselves and our loved ones from this hidden threat? Stay vigilant, protecting yourself from West Nile virus. Dr. Staub has urged residents of Maricopa County to remain vigilant, especially during the monsoon season when increased rainfall creates ideal breeding conditions for mosquitoes. Monsoon season brings much-needed rain, but it also creates ideal conditions for mosquitoes to breed, he explained. This highlights the critical need for proactive measures to reduce mosquito populations around our homes. For those particularly at risk, such as individuals aged 60 and older, those with underlying health conditions, or anyone with a compromised immune system, here are some recommended strategies to minimize the risk of infection. 1. Utilize insect repellents that contain DEET or picaridin on any exposed skin to deter mosquito bites. 2. Dress appropriately by wearing lightweight clothing that covers your arms and legs, providing an extra layer of protection. 3. Eliminate potential breeding sites by scraping the sides of containers and potted plants where mosquitoes might lay their eggs. 4. Ensure your home is secure by checking that window and door screens are intact and free from holes. 5. Remove standing water from items around your home, such as plastic covers, buckets, old tires, plant trays, pet bowls, toys, and boats, as these can serve as breeding grounds for mosquitoes. We want to hear your thoughts. What do you think about the measures being taken to combat the West Nile virus? Do you feel adequately informed about the risks and prevention strategies? Share your thoughts, experiences, or any story ideas with the KTAR News team. Your voice matters in this important conversation. First West Nile virus death in Maricopa County, what you need to know. Breaking: a devastating first fatality linked to the West Nile virus has struck Maricopa County, sending shockwaves through the community and raising urgent health concerns. County officials confirmed that this tragic death involved an older adult who had underlying health conditions, a stark reminder of how dangerous this virus can be for the most vulnerable among us. According to a July 21 news release from the Maricopa County Department of Public Health, a total of 17 human cases of West Nile virus have been identified in the county this year. In Arizona, where mosquito-borne viruses are most common, the critical period spans from May through October, corresponding with the height of mosquito activity. This seasonal pattern means that extra caution is essential during these months. Dr. Nick Staub, the department's chief medical officer, explained, the monsoon season provides much-needed rain, but it also creates ideal conditions for mosquitoes to thrive. That's why it's so important for residents to remain vigilant, using insect repellent, eliminating standing water around their homes, and reducing outdoor exposure during peak mosquito hours. His advice is particularly aimed at older adults and individuals with pre-existing health issues, who are at an elevated risk of experiencing severe complications from the virus. While the majority of those who contract West Nile virus do not exhibit any symptoms, about 1 in 5 may develop a flu-like illness characterized by fever, headache, and muscle aches. More alarmingly, in rare cases, roughly 1 in every 150 infections, the